Arrhythmia typically means anything different from a normal beat.
So we can bend down and stand up, cough or roll over, and we're all going to get a skip beat. And those are for the most part benign. We don't want to make everybody a cardiac cripple for every single skip beat.
Can cause symptoms, most commonly in the form of palpitation.
In this video, we are going to dive into the world of arrhythmia, exploring what it is, which symptoms indicate a serious heart problem, and natural remedies available to help keep your heart healthy and strong. Make sure you stick to the end, because I am going to share one super healthy, heart-friendly food that its impact goes far and beyond the heart but also to the general body health. Hi, it's Nawairi here. Did you know that your heart can beat out of rhythm, putting you at risk for serious health complications? Stay tuned to discover everything you need to know about this common but often misunderstood condition. Without further ado, let's jump in. I believe that in the past you may have ever felt a palpitation of the heart and so many thoughts came into your mind. Irregular heartbeats occur sometimes, and most of the time they are harmless. Arrhythmias are irregular heart rhythms brought out by a faulty electrical system within the heart. To put things into perspective here, the heart normally beats about 60 to 100 times every minute. Arrhythmias can be broadly categorized into two broad groups. If the heartbeats are greater than 100 beats per minute, then a condition called tachycardia can arise. On the other end, when the heartbeats are less than 60 beats per minute, another condition called bradycardia arises. Heart arrhythmias, which can feel like a fluttering or racing heart, are usually harmless. Some of irregular heartbeats are not dangerous and are mild symptoms of arrhythmias. They include skipped beats, fatigue after carrying out physical activity, dizziness, and chest discomfort. However, it's important to speak with a healthcare provider if you experience any symptoms, as arrhythmia can sometimes be a sign of an underlying health condition that requires treatment. The following symptoms indicate a more severe cardiovascular issue. Mild to severe arrhythmias can occur, although not all arrhythmias are harmful. Certain arrhythmias, however, may be a symptom of underlying cardiac disease or may trigger life-threatening complications like a stroke or heart failure. The following are some indications that an arrhythmia can be dangerous and call for medical care. 1. Recurrent or persistent palpitations are feelings of an erratic or fast heartbeat. It may be an indication of a more serious arrhythmia if you have persistent or frequent palpitations, or if they are accompanied by other symptoms like chest discomfort, shortness of breath, or fainting. 2. Dizziness or lightheadedness. If you're feeling dizzy or lightheaded, it may be an indication that your blood supply to your brain is being restricted, which can happen with some types of arrhythmias. 3. Fainting or near fainting, also known as syncope, which can occur with some types of arrhythmias, may be a sign of a more serious problem. 4. Breathlessness is a symptom that the blood supply to your lungs is being restricted, which can happen when you have certain forms of arrhythmia. 5. Chest pain or discomfort may indicate a significant heart arrhythmia or other illness. Do you find this type of content helpful? Support us by subscribing. And please comment that I subscribed so that I can welcome you to this growing community. Arrhythmia is a serious condition that can affect your heart health. Some types of arrhythmia can be very dangerous and require immediate medical attention. Without proper treatment, arrhythmia can cause the following complications. 1. Cardiac arrest, when an arrhythmia causes your heart to stop beating suddenly and unexpectedly. 2. Heart failure. Repeat arrhythmias can lead to cardiomyopathy, which is when your heart becomes too weak to pump enough blood to meet your body's needs. 3. Problems with thinking and memory. People with arrhythmias may be at higher risk for Alzheimer's disease and vascular dementia because the irregular heartbeat may reduce blood flow to the brain over time. 4. Stroke. With arrhythmias, blood can pool in the upper chambers of the heart, forming clots that can travel to the brain and cause a stroke. 5. Sudden infant death syndrome. SIDS. Babies born with certain types of inherited arrhythmias may have a higher risk of SIDS. 6. Worsening arrhythmias. Some types of arrhythmias can get worse over time or trigger other types of arrhythmias. Enough with the gloom. We have natural remedies and heart-friendly foods that one can incorporate in their daily diet, coupled with exercise to develop a strong heart that pumps well. 1. Fish. Fatty fish like salmon, tuna, and mackerel are high in omega-3 fatty acids, which can help reduce inflammation and the risk of developing heart disease. Omega-3 fatty acids can also help regulate the heartbeat and prevent arrhythmia. Aim to eat fatty fish at least twice a week. 2. Whole grains. Whole grains like brown rice, whole wheat bread, and oatmeal are high in fiber, which can help lower cholesterol levels and reduce the risk of heart disease. Fiber can also help regulate blood sugar levels, which can be beneficial for people with diabetes, as diabetes is a risk factor for arrhythmia. 3. Fruits and vegetables. Fruits and vegetables are rich in antioxidants and other nutrients that can help protect the heart and reduce the risk of developing heart disease. Berries, leafy greens, and citrus fruits are particularly rich in antioxidants and can help prevent arrhythmia. 4. Nuts and seeds. Nuts and seeds are rich in healthy fats, fiber, and other nutrients that can help reduce inflammation and the risk of developing heart disease. Almonds, walnuts, and chia seeds are some examples of heart-healthy nuts and seeds that can be incorporated into your diet. 5. Lean protein. Lean sources of protein like chicken, turkey, and beans can be part of a heart-healthy diet. Red meat and processed meats, on the other hand, should be limited or avoided, as they are high in saturated fats, which can increase the risk of heart disease and arrhythmia. 6. Low-fat dairy. Low-fat dairy products like milk, yogurt, and cheese can be part of a heart-healthy diet as they are rich in calcium and other nutrients that can help protect the heart. However, it's important to choose low-fat or fat-free options, as high-fat dairy products can be high in saturated fats. Now for the bonus food substance that I stated earlier, it is flax seeds. This is a miracle seed whose impact goes far and beyond the heart health. Flax seeds are good for the heart because they are a rich source of omega-3 fatty acids, specifically alpha-linolenic acid, ALA, and lignans, which have antioxidant properties. These compounds can help reduce inflammation, lower blood pressure, improve cholesterol levels, and protect against cardiovascular disease. However, it's important to consume flax seeds in moderation as they are also high in fiber and can cause digestive discomfort. It's best to consult with a healthcare professional or a registered dietitian to determine the appropriate amount of flax seeds for an individual's needs. In conclusion, arrhythmias are a serious condition that can have long-term health effects if left untreated. Remember, a heart-healthy diet is just one part of a healthy lifestyle. Regular exercise, maintaining a healthy weight, not smoking, and managing stress are also crucial factors in preventing heart disease and arrhythmias. Did you find this content helpful? Show us some love by subscribing. Thank you for watching. Peace.